We often talk health here on TSB, and I think as a lot of men, we tend to take our health for granted. When something goes wrong, we tend to think, oh, it'll be fine. Let's not worry about it. And we don't really get the professional advice we often need.
Well, I mean, that's more skewed towards men as compared to women, and I personally feel so that men tend to be like, that's all right. I have a little pain in my tummy, but I'm okay. That's all right. I'll just probably have, half a glass of soda, and I should be fine with it. I mean, a couple of burps, and then the man thinks that, oh, it's all right. I mean, there's nothing wrong with me.
Well, our next guest is Dr. Subir Chakraboty. He's the consultant nephrologist and medical director at Renacare Dialysis Clinic in Dubai, and he's here to answer all of your questions in regards to kidney and chronic kidney disease. Doctor, thank you very much for joining us on Talk 100.3.
Yeah, good evening.
Good evening. Thank you very much. To start off simply, what is chronic kidney disease?
Yeah. Chronic kidney disease, as the name suggests, chronic means long-term. Kidney disease. So kidney disease, which is long-term, which is progressive and irreversible, is called chronic kidney disease, where the gradually kidney function loses its function from 100% to 90%, 80%. And when it comes to 10% or 15%, that is, we calculate as a GFR, glomerular filtration rate, it is at this stage that renal replacement therapy is required in the form of dialysis.
This sounded like my iPhone's battery that starts with 100% and then keep progressively deteriorating, and then you need to put in an external charger. And that's exactly how an external dialysis comes into play, and that does the role of the kidneys, doesn't it?
Yes, exactly. Because kidney diseases, chronic kidney disease especially, is called as a silent killer.
Mm-hmm.
And so as diabetes and hypertension, these two are, the incidence of these two diseases increasing in the society all over the world. And diabetes, these are silent killers that slowly affect the blood vessels and also affect the kidneys.
Right.
So slowly they lose the function.
What are some of those signs that we should pay attention to that might indicate we have some kidney issues and we should seek professional help?
Yeah. In kidney disease, actually regular checkup is very important because many times it is asymptomatic.
Okay.
Till a significant amount of kidney function is lost, we don't get any symptom. But the common symptoms which we should be aware of, first is the swelling over the face, over the leg, over the abdomen, because of the excessive retention of the fluid, can be important sign of kidney disease. Then there can be symptoms related to our gastrointestinal symptom like loss of appetite, vomiting, change in the taste. And another important thing is the blood pressure. Kidney is the regulator of the blood pressure also. So high blood pressure could be due to kidney disease, especially at a younger age. If the blood pressure is below 30 years of age, then kidney disease could be a cause. Then it also leads to anemia. Anemia is the low blood, low hemoglobin. And anemia, anemia low, it causes like weakness, lethargy, loss of energy. Then there are non-specific symptoms, itching of the body, low backache, generalized weakness, and then urinary complaints. Any problem in the urine, like if there is blood in the urine, if there is increase in the frequency of the urine, if there is obstruction to the flow of the urine or retention of the urine. So these are some of the symptoms which you can find in kidney diseases.
Right. But then, doctor, there is many a times, generally it's spoken about the use of kidney. Normally people think that, the heart, the liver are the most important organs. They generally tend to, undermine the value or the importance of kidneys. The only time we think of kidneys is when we read a price of an iPhone and say, iske liye to kidney bechna padega. But what is the use of kidneys?
See, kidneys are one of the most important vital organs because all organs of our body is working continuously.
Right.
And there is a metabolism going on in the body which utilizes the oxygen, and waste products are continuously being produced.
True.
The level of the waste products go into the blood, and these are harmful to all our body systems. And which is removing the waste products and purifying the blood. These are the kidneys. Both the kidneys have 1 million filters, which we call nephrons, and 24 hours without any rest, continuously they are filtering and cleaning our blood. So kidneys do the most important function of keeping us purify our blood.
So given that, how can we take better care of our kidneys? I mean, should we be drinking 8 glasses of water? Are there certain foods? What's the best thing we can do?
Yes, yes. Actually, there is a rule of 7. For an ordinary person, there are 7 advices which are generally given to maintain healthy kidney. If you love your kidneys, then
I
follow
love them.
the 7.
I love my kidney.
One is be fit and active.
Okay.
Exercise, right?
Yeah.
Exercise. Regular exercise is a very important thing. Then balanced diet. Balanced diet means your diet should have all the minerals, and you should avoid excess of the sugar, excess of fat, excess of protein in the diet, and it should contain a lot of vegetable and fruits. That's good. Then keep your weight in check. There's a direct relation between the obesity, overweight, and the kidney function.
Okay.
So regular exercise diet will maintain it. Then smoking and tobacco. Avoid them. They are bad for the kidneys. Then beware of the over-the-counter medicines.
Okay.
Like especially the painkillers, because painkillers, these are harmful to the kidneys. Like ibuprofen and many painkillers are available. Similarly, there are those youngsters who are going for bodybuilding.
Right. Yeah.
They are taking a lot of hormones and the proteins and some energy materials, energy drinks. So we should be very careful about those. This could be harmful to the kidneys.
My next question, doctor, was about this. Since you mentioned that not too much of protein, but then as per the regulations, or as per what you read and understand, human beings require 1 gram per kg of body weight of protein. That is required. Now, for someone who's a vegetarian, okay, like I'm a vegetarian, I can't get and I weigh 80 kg, so I can't have 80 grams of protein through my food. Right? I mean, paneer or tofu or beans or whatever I have. So I have to have, say, a protein supplement, which is, say, whey. And if I consume whey, does it put in excessive pressure on the kidneys? Does the filtration affect kidneys? Or does it just say, okay, listen, 80 is okay, but don't go to 280?
Yeah, absolutely. You are absolutely right. That there's a normal requirement.
Right.
As you said, 0.8 to 1.2 gram per kilogram body weight. Normal requirement of protein should be taken, and the good articles of the kidney, as you said, these are plus the egg,
Right.
plus the fish. These are non-vegetarian things. In vegetarian, as you said, cheese is a good, soya bean, and the tofu and other
lentils,
things are lentils. These are good things. No, normal it should be taken.
Yeah.
But I am taking for bodybuilding,
Right.
purpose of bodybuilding, or some people are taking excess. They are
Excess, yeah,
taking 2 gram, 3 gram per kilogram
Right.
body weight.
And then
That's
obviously
harmful.
uric acid also then builds up and then compounds the problems for them.
Exactly.
So what about caffeine? I'm drinking a cup of coffee now.
It's
Is
okay.
this good or is this bad?
No, caffeine is okay.
Okay.
Caffeine is
But
okay.
what about the levels that I drink?
I mean, probably
caffeine-
if you go for his blood test, you know what will happen? You'll get more coffee in the syringe as compared to the blood.
Actually, caffeine is a mild diuretic also.
Diuretic, yeah.
Mild diuretic. So if you are hydrated well and you take caffeine, it helps in diuresis, and especially it will help you in the cases of small renal kidney stones.
Oh, okay.
Yeah,
Good,
yeah.
because being in radio, traditionally a lot of radio announcers got kidney stones because they sit down
Yeah,
so much.
for
Yes.
4 hours and then
And I've never got them, so it must be the caffeine.
I'm telling you.
But no, look. On a serious note, kidney disease can be quite debilitating, especially if someone is on dialysis. And we've heard about this. But what is dialysis, and what is life like? In real terms, we're not trying to shock people here, but what is life like for someone who was on dialysis, for a patient and for the carers?
As I told you, both kidney have about 1 million of filters. So where the blood is filtered and our waste products are filtered from the blood, goes into the urine. Similarly, dialysis, in which we use a instrument which can called dialyzer, and this dialyzer is artificial kidney, where there are thousands of tubes of semi-permeable membranes are there.
Yeah.
That's created, and through this semi-permeable membranes pass the blood, and around that passes the dialysate. So the principle of semi-permeable membrane is that when suppose something is in higher concentration in the blood, like urea, creatinine, other waste products, and on the other side is lower concentration, so it passes through the
Right.
semi-permeable membrane, and thus the waste products pass from the blood into the dialysate, and so the blood is cleared.
Okay.
And
So there are two mechanisms. One is this is called diffusion. By this process, waste products are removed, and another process is ultrafiltration, where due to the pressure difference, water passes from the blood to the dialysate.
Okay.
As you know, the kidney has one important function of removing the waste products. Second important function is to remove excess fluid.
Water,
Suppose we do to drink 5 liters of water, over a period of few hours it will pass.
Right.
So with that we can control the fluid also.
Mm-hmm.
Because you know, when people don't pass urine over 2-3 days, they accumulate about lot of water. Some people accumulate up to 5-6 liters of water.
Wow.
That if goes into the lung, it will cause heart failure,
Right.
severe lungs problem. So we remove the excess of the fluid
also.
also
Okay.
during the dialysis.
And how often does one have to do that if they are on dialysis?
Actually, dialysis has to be done actually at least 12 hours per week.
Wow.
12 hours per week. Okay.
So normally we do our dialysis session generally is of 4 hours per session.
Okay.
So 3 times per week is the ideal one. But if due to some financial constraints, etc., if people cannot do, at least we do 2 times a week.
Now, is that done at home, or do you need to go to a hospital to have that done?
Which dialysis?
Dialysis, yes.
Yeah. Generally, there are hemodialysis centers. They are either in the hospitals
Okay.
or in the standalone hemodialysis centers. That was the traditional concept. But nowadays, the concept has come of home hemodialysis,
Okay.
where here in that the patient comes to hospital. Now here the hospital goes to the patient.
Wow.
Yes, we take the machines, hemodialysis machines, doctors, nurses, we go to the home of the patient and provide him the dialysis services at the comfort of the home.
Wow.
And that is in the UAE, that is picking up very well now.
We're currently talking to Dr. Subir Chakraboty. He's the consultant nephrologist and medical director at Renacare Dialysis Clinic in Dubai. Doctor, on that point, if someone's on dialysis in India and they come over to the UAE for holidays, what is the process? Can they come and see you at Renacare? Can you offer support? What are the possibilities?
Yeah. Actually, at Renacare Multi-Specialty Healthcare, we have a very good dialysis unit, and we have state-of-the-art dialysis machines, and the system we have developed very superior quality.
Yeah.
Plus the staff we have is a very, very trained, high quality. So whatever dialysis are done in good centers in India or other countries, the same service we can give here. And the other good thing is that here we give it's a very homely atmosphere.
Okay.
And there's privacy. We give the privacy to the patient, and very homely atmosphere we can do. So whatever dialysis he is getting in his home country, the same comfort and same quality we can give here also.
That is really, really amazing. And we also heard that there is an open day that you've kept at Renacare on
Yes.
the 1st of October. If you could give us some information about that.
Yeah. This Saturday, next Saturday we keep an open day. We have done before also,
Okay.
where the dialysis patients or any other person who are interested in dialysis or the kidney care, they can come to our center, see the services in our center, and they look and they can make an idea that in Al Mamzar, Dubai, such a center is available.
Wow.
So yeah,
This
that's right.
is
you're right.
amazing. But then it's important that we take care of our kidneys. It's important that we take care of ourselves, eat the right food, do our exercises. But for someone who is on dialysis, does things change? Do they have to be on a special food medication or exercises or control whatever they are doing?
Yeah. See, like in every disease, dialysis also there are some rules, some regulations have to be followed. Like they have to take the medicines which are required for their improving their blood, for maintaining their normal bone. They have to take some medicines. Plus they have to control their for control of the blood pressure and sugar. They have to take medicine.
Right.
But other than that, if the regular dialysis is done 3 times, their life is almost as good as a normal person.
Wow.
Actually, many of our persons who are on dialysis for 10 years, they come driving their car, they park the car, they do dialysis, and then again they drive the car and go back to their
Wow.
work.
Well, they're probably healthier than they've ever been because they're finally looking after themselves properly, to some degree.
Right.
They're having a balanced diet. They're doing things they should have done years ago.
Right. Because as you said, no, the condition of the patient depends on his comorbidities also. Suppose it is only kidney involved, after dialysis he'll be perfect. But suppose he's elderly person,
Right.
he has heart disease also and other disease also, then his life will be relatively less active than the other one.
But then these are like cousins, right? They all come together for summer vacation. Diabetes, high blood pressure, heart ailments, and kidney problems. They generally come in together. One comes, the other follows. Is it true?
You are right. Okay, generally, the more the comorbidities, more the chances of other organ getting involved.
Right.
And our human body is not isolated. It is a unique body. It is body and all the organs are affected. All the organs are interrelated.
Right.
Like kidney, it purifies the blood, and that purified blood is required for the heart function. Similarly, heart functions and it supplies the blood to the other organs. So these are all interrelated. So if one organ is affected, it leads to the affection of the other organ. Like there are cardiorenal syndromes.
Right.
So cardiorenal syndrome, there are 4 types of cardiorenal syndrome. They describe the effect of heart on the kidney
kidneys.
and vice versa.
Wow. Yeah, look, it's amazing. If you want more details, the website is mshc.ae. There you can find more details about the clinic open day, which you said has been successful previously. It's coming up on the 1st of October. That is where you can get there and you can find out all the details where it comes into symptoms for kidney diseases, diet tips for dialysis patients and how to prevent kidney disease. This has been a very informative one. I know now, Neil, I need to drink more water and not be so worried about drinking my coffee. That's what. But also, on a serious note, this really is a silent killer for a lot of people.
Yes.
Yeah, definitely. Well, Doctor, thank you very much for coming in. We've been speaking to Dr. Subir Chakraboty, the consultant nephrologist and medical director at Renacare Dialysis Clinic in Dubai. If you want more details, that website is mshc.ae.